everyone, welcome back to my YouTube channel. I am Niharika and I am an international medical graduate from India. I have applied for Match 2025. To give you a real-time update, I have submitted my rank order list and I'm so happy and nervous and excited. Today I've got you a very interesting video and I have not seen a lot of people talk about it. Once you get a rotation, how do you navigate through it? Like, now you are in there, in the hospital or in the clinic, and now how do you perform? How do you make that lasting impression on your preceptor? Because at the end, that will be written in your letter of recommendation. Without further ado, let's dive right in. So honestly, if I talk about my experience with the rotations, I already mentioned that I was really heartbroken, but when I got those opportunities, I was really happy. I knew that I had to perform really well because that is what I have in hand. Once I got those opportunities, I did not think that, oh my god, I did not get a rotation at those big name places. I completely lost that idea. I only had in mind that, look, this is my final chance to shine and I have to give my best in these rotations, and that is all that matters. So in case you are in my place, so just remember that give your best in this rotation. I did not think about the subsequent rotations. I only thought about the one I was in. And since I have been through all those rotations, I thought that I should share everything that a lot of people do not talk about, things that I've learned through my experience and my mistakes and my struggles. So I'm gonna keep this video in 3 segments, and the first segment would be like how to start off a rotation. Then the second segment would be how do you actually navigate through the main rotation, and last would be how do you end a rotation on a really high and a good note. So that's gonna be the format for today's video. So starting with the beginning of the rotation. So the first thing that I would want to address in this segment would be to know your preceptor. Like all the information which is out there on the internet about them, like where did they do their residency from, what fellowship have they done, and from where, and do they have any special research or any interests, or did they do anything? Because a lot of information is available on the website of the hospital. So I think you should know all of that. Probably they have done their residency from a place where you want to do it, and so that can subsequently help you. So make sure you know all that information about your preceptor. Second thing that I want to talk about is your dress up, like the way you dress up during your rotation and your first day. So this is a funny story. Like once you are in the US, you understand how the system works. So when you are meeting up with a person for the very first time, you are like in the default setting, you are expected to wear business formals, but I would always wear scrubs because I did not know that scrubs are quite informal. So make sure on the first day of your rotation you wear business formals. Okay, you wear a very neat and clean shirt and trousers, probably a coat. Coat is like really formal, like an overcoat is really formal. But make sure you do not wear scrubs. That is very informal. I did it, and people around me were so polite that they did not say anything. And I figured it out when it happened with me 3-4 times. I would be always thinking, why do people wear shirt and trousers when they're meeting with me for the first time, and then they subsequently start wearing scrubs? Then I realized that it's informal to wear scrubs for the first meeting. So make sure you do not do that mistake. Make sure you carry your scrubs, because eventually you can wear it if your rotation allows it, but do carry business formals with you. That is very important, and wear those on the very first day of your rotation. Your first impression's gonna be your last impression, and that is going to have a very lasting impact. So make sure you look really nice and put together. The third thing that I would want to talk about is something that you should talk about in the very first meeting. That you have to ask them, what do you expect from me during this rotation. Like, what do you want me to do? What do you think are my daily responsibilities? Where should I report? How should I do things? So you can ask them this. This gives a very good impression as to you are interested in knowing about the rotation and how it's gonna be. Plus, you are following a structured format. So this shows that you have, organization skills. The fourth thing under this big title would be telling them what you expect. Like, as I already mentioned, once I did not get the rotations at those big name places, I decided it for myself that, okay, what if I don't have electives? But whatever rotations I have, I'm going to structure them the way they do it at Cleveland Clinic or Mount Sinai or Harvard or whatever it is. I am going to behave like the same person who would go there and do it, right? So I'm going to structure it like that. So I would also tell them what I expect. So I would always tell them that, look, consider me as a resident only, because I am not only here to do the rotation, but I am also here to do kind of a pre-training before my residency starts. So I want to get the full taste of how residency feels like. What are the daily responsibilities of a resident? How do you do notes and everything? You can mention that, look, I'd like to get as much hands-on experience as I can. I want to be a part of procedures. I want to take histories. I want to take physicals. Like whatever your expectations are with this rotation. I'd also like to give some talks and presentations, say bi-weekly or at the end of each week, and anything, like whatever your expectations are, just mention them. These are all the things that I would tell them. You can tell them your expectations. Make sure you tell them, always tell them when they ask you what are your expectations, as in to give you feedback. Tell them that, okay, I'm gonna be here for say 4 weeks, so I would like, weekly feedback. I would really appreciate if you could tell me if there are any aspects I can improve on. That gives a very, very nice impression of you, who you are as a person, because taking feedback is the best thing that you could do on your rotations. And it's not just about saying it, but actually implementing it. So also, once you start the rotation, every hospital has a different way of working. And so sometimes, a particular hospital does not have a format for rotations, but since you get a sponsor or a preceptor, you can rotate there. So sometimes you can get a badge which can allow you the entry into different parts of the hospital, because look, it's not as easy as in India. You just cannot enter a hospital like that. So make sure you have that badge. Like, ask your preceptor if you need to get a badge or an ID. Make sure you always carry a diary and a pen, because that shows that you are taking notes of the important things. So finally, you have started the rotation on a very, very positive note, and you're finally there. Now, how do you stand out during the rotation? That's the second big title, and we are going to be covering multiple points in this aspect as well. First go-to point would be professionalism and respect during your rotation, and that is not only with your preceptor but with the other staff as well. So there is a concept of a PA student, which is a physician's assistant. So they could be a student or they could be a PA. So you could be rotating with those students. You could be rotating with nursing students, or you could have other colleagues with you, like who are applying for residency as well. So make sure you are always respectful, not only just towards your preceptor, but towards these other people as well, like towards the staff as well, like the pharmacy team, the nurses, the respiratory therapists, like everyone. I'll tell you a little thing that I used to always do is that my preceptor would, pick me up for the hospital, because it was a long walk, but it would only take him, just 5 minutes to come till my accommodation, and then we would go together. So every morning, first I used to greet my preceptor, like in the text, say good morning doctor this, and then I would say that I am ready, kindly let me know whenever you are here, or whenever you're going to be here. So he would like mention that I'm going to reach in 5 minutes, so I would be outside. Like I would never ever keep them waiting. This shows a sense of punctuality and the way I respect this opportunity. I would always greet other people. I would always meet them in a smiling way, so that I would not look grumpy and sleepy. Never ever do that. Just to give you a little tip, like I used to put on a little makeup, like I used to put on a little blush, a little mascara, that would just make me feel good about myself and the day and everything. So this is just a little tip for the girls, that like dress up the way you want. And for boys, like have a clear face, like shave your face, put your hair in a nice, your hair should be short and nice. So these are little things that actually show the qualities you have, and they go a long way. Look, I'll tell you one thing, that if it's gonna be even a 2-week rotation, it seems like a small amount of time, but during this time a lot of things happen. You have to always remember that you never ever have to cross that line of respect for them. You always have to greet them, you have to say thank you. And so these are very very little points that go a very long way. So always remember that. Other thing that can be counted in the same aspect would be never interrupting your preceptor, like when they are speaking, or we are having like rounds in a team, like which we call as multidisciplinary rounds. Make sure you ask them that Dr. X, like for example Dr. Tanwar, do you want me to ask the questions during the round or once the round ends? So this can give a very positive image about you. Make sure you are observant, you ask questions, you are never interrupting them. The second point that I would want to discuss in this would be kind of getting the hang of the American culture. Look, I would say that when you are in a new place, you obviously want the other people to be accepting. I'm not telling you to completely change your personality, but there are certain public norms kind of a thing that a culture follows. Like for us in India, it's not very common to smile and greet each and every person that comes across us at our workplace. But in America, it is like when you come across the nurse that you have already worked with, or probably you are sitting in somebody's seat and they come, so you always greet them, you always say sorry and thank you. And I was a bit frustrated in the beginning. I was saying so much of sorry and thank you, but then you become used to it. And I think these are nice gestures, especially when you are a stranger. So make sure you actually get the hang of those little American culture details, because that will make you more acceptable there. Just be polite with everyone, be nice with everyone. People there, they are very very helpful. In case you are not able to do something, they will always ask you if they can help you with anything. So be it your preceptor or the staff or anything, and you see somebody struggling with anything, always ask if you can do something for them. Plus, another thing that I would want to address in the same point would be getting to know the common words that they use. Like, for example, what we call as wards here in India, they call it as floors. Like in India, we say that could you please shift the patient from ICU to the ward, to the general ward. But there they say we are shifting the patient from the ICU to the floor. Okay, there are different places that a person can be transferred to from the hospital if they are not going home. It could be an LTAC, it could be a skilled nursing facility, which they called as SNF. Okay, it could be a rehabilitation center. So there are a lot of different terminologies that they use, and never ever shy away from asking the meaning of those things from your preceptor. Okay, because that person is your point of contact. Like you can ask everything from them, and trust me, everyone, like most of the people in the US, they are international medical graduates. They know how it feels, they know what is the experience. They will always help you. So don't worry if you are asking a general thing. Don't feel that you are asking a stupid question. Make sure you familiarize with all those terminologies, because that will help you a lot while you are giving interviews. Because then when you are going to be using those common words, the person who's going to be interviewing you will understand that yes, you have done that rotation and you were really there and you're not lying. Then we come to the next point, which is asking questions. And if I say asking questions, it means asking all types of questions, be it related to the kind of antibiotic your preceptor has chosen. And a lot of you would agree with me on this, that it's very, very difficult for me to choose the antibiotic. If I think about it, I feel so confused that what kind of antibiotic should I use? Why are they giving this antibiotic instead of that one? So, I asked my preceptor that, it's very difficult for me to understand the antibiotics and when to give what. So, this is not a stupid question. He told me that, look, every hospital has their own policies, every population is different, every population has got their own resistance. So we have to follow the hospital rules, this and that. So that is a potential question. Don't think that any question is stupid, just ask that question. So make sure you ask a lot of questions. If you are allowed during rounds or even after rounds, you can jot down those questions in your diary that I mentioned during the rounds, and you can ask those after that. And make sure you do that, because that shows that you are actively participating in the rotation and you're not just here for a letter. That is the worst thing that you can do if you give out an impression that you are only and only here for a rotation. Another thing that can show your willingness towards the rotation would be the time that you stay in the hospital. First 2 rotations of mine were in intensive care. So my preceptor would be there from 7 a.m. to 7 p.m. So I would be there for the whole time, because I was on top of the patients. I was always asking questions, and not like that I came in the morning and then I'm leaving early in the evening and not doing. So I would make them feel my presence there, that yes, there is a person who has come here to rotate. They are very much interested. They want to gain something out of this experience and not just take the letter. Okay, so make sure you do that. I'm not saying that you forcefully just sit there idle. Don't sit there idle. You have so much of work. You can work on your application, your personal statement, do so much stuff, actually read about a topic. So don't just give out an impression as if you are there for the sake of doing it and just to get a letter. Do not do that. So another important point that I would want to discuss would be patient safety and following the HIPAA format. So this is very different from what we practice in India. Like in India, it's very common for us to discuss patients in public, on texts, with anyone we want, like the family members, with our friends, with our colleagues, anyone. But it's not like that in the US. They are very, very particular about patient privacy and confidentiality. So I still remember I learned it through a mistake. I texted my preceptor, and in America you always call a person who you do not know with their second name. So for example, there is a patient X. So I texted my preceptor on iMessage that I'm not able to find Mr. X, and he did not reply. And then eventually I found it, and then we met, like I and my preceptor, we met. So my preceptor was like that, look, you cannot share the patient's name, even the patient's name, on a text. Okay, and I was very apologetic about it. I said sorry, I deleted the message, and I made sure that I never ever discuss the patient. So what you do is that you always know the patient's room number. So you always mention patient's room number on a text or WhatsApp or anywhere you want to discuss. Oh, patient in room 203 was deteriorating and was not able to sleep, and this and that. So that is how you address the patient. But when you are in there with the patient, then you address them with their name. Okay, so that is something that I learned and I made a mistake with. So never ever do that. Patient's privacy is important, so much so that what happens is that in America you have a list of patients that your preceptor, or even when you become a resident, you get a list of patients which has like the name of it's like a table which is printed on a paper, and the name of the patient is there, the diagnosis, the provisional diagnosis, or if they have been diagnosed finally is there, and you have to follow that table because it has all the names of the patients and everything. and their room number. So make sure you do not lose out on that sheet, because that has all the patient information. I used to write a lot of things on that sheet, but make sure that at the end of the day, or if that particular sheet has a lot of information, then at the end of the rotation you discard all of those sheets. And in the US you cannot even discard it in a regular dustbin. You cannot discard that sheet of paper which has a lot of patient information in a normal dustbin. There are special shedders, like you will, once you see them, you will know that those are the designated bins where you put that patient sheet. Okay, so do not discard it just like that. Do not lose it, do not leave it anywhere. Just be very, very responsible with all your stuff. The next thing that I'm going to be talking about is case presentation and SOAP format. So what happens is that there is a particular format that we follow in the US, which is the SOAP format, which I did not know even when I started my rotation. I mean, I did not go and look up at how do you present a case in the US, but I'm telling this to you that there is a particular format which is called SOAP format. S for subjective, O for objective, A for assessment, and P for plan. So assessment and plan, you call it A and P, okay, which is the main part in SOAP. And you have to go either problem wise, like the most important problem that the patient came in, like say for example it's pneumonia, and then you go to the least important problem, say if the patient is not able to sleep, for example, right? Or sometimes you go in a system kind of a format. So it depends on the preceptor how they follow a format. So you can always ask them that could you please guide me with the SOAP format, and how do you like to take histories, so that I can follow that format and present in a similar way every day. Because I will highly recommend you to do that. Like, this is the least you can do. Even during observerships you are allowed to present cases. So it will also enhance your skills of history taking and case presentation. Like, if you're allowed to take history or not, that depends on rotation to rotation, if you're allowed to interact with the patient, but you can at least present the cases, because a lot of information is present on the EMR, and you will only be able to navigate through that once you are there and you know how much you can be involved, like if you can use the EMR or not, you don't know. Okay, so just remember that always ask your preceptor what kind of history they like. Do they like to go problem wise? Do they like to go system wise? And do that each and every day. Like, take a minimum amount of patients that you have. Like, I think it is 3. Like, maximum is 3, but minimum should be 1, and you start with 1 patient and you subsequently increase it in then 2 and then 3, and make sure that you take histories, you brush your skills of history taking and case presentations, because trust me, everything that you do during your rotations will reflect in your personal statement, your application, and then eventually in your interviews. Do not take your rotations lightly. Don't think that you are on a vacation. Don't think that it is not a good opportunity. Like, take every opportunity as a golden opportunity to shine. Take every day to do something different. Like, while I was on my rotations, I promised myself that, look, my first rotation is just 2 weeks. I want to do something different every day. Like, I want to progress every day. If today I took the history, the next day I want to present cases. If today I presented 1 patient, tomorrow it's going to be 2 patients. So, like, think of different things that you can do on a rotation. Think of all the topics that you can talk about in a rotation, and you want to learn from your preceptor. Okay, and that is how it shows that you are really enthusiastic about this opportunity. So there are a lot of videos which can help you understand what the SOAP format is, but I would highly recommend that sit with your preceptor and ask them that, how do you take histories, and they will surely help you out. The next point that I would want to talk about is doing your homework, and taking initiative also. What I mean by this is that, for example, I would always ask my preceptors that, you give me topics and I'm going to be reading about it, and I'm going to be giving small talks about the topic. And what does a talk mean is that I'm going to be telling them what I learned. You call it the fancy word talk for that. So always remember that you can add all those points in your application, that I gave a talk on this and that, I learned about this topic and everything, right? So for example, like my first rotation, my preceptor was an intensivist. This was a new word. I mean, I did not know what was the difference between an intensivist and internist when I started off with my rotation. So don't worry, I was there, and you will eventually learn too. If you hear a new word, always look it up on the internet, that what it means, so that you know what it is. So my first preceptor, he was an intensivist, that is, he was an ICU doctor, and he was also a nephrologist. So he was very much interested in dialysis and different topics related to nephrology. So he used to give me topics and tell me that you can read up on these topics. So I would try to read up on those topics during my rotation only, because I had a lot of time. 7 a.m. to 7 p.m. I had a lot of time, so I would always read on those topics, and then I would get back to him, and I would like make notes, and I would explain it to him what I learned, and then he would give me his feedback and also tell me more points on those topics. Always be proactive in the sense that like for my second rotation, my preceptor, he was again an intensivist and a pulmonologist. So he gave a presentation on pulmonary embolism for the ICU staff, and I was so thrilled with that presentation that I asked my preceptor that I want to give a presentation too. So he said that I'm not sure if you will be able to give presentation in the ICU because everyone is so busy, but the clinic, I'm gonna make sure that you give a presentation and people are gonna be there. So I presented a presentation with the PowerPoint and everything on biologics in asthma. That was my topic because my preceptor was a pulmonologist, and it was a superb experience. Trust me, it's gonna be so good, and it's gonna show how you are taking initiative. So make sure you give a lot of talks, you ask if you can give presentations, you ask them about anything which is happening differently in the patient, something that you're not already aware of. If there is a new diagnosis, ask them. Secondly, ask them that do we have any unique cases so that I can write any case reports. Are you working on any research paper that I can be a part of and I can help you with that? These are such small points that people can miss out on, but trust me, if you do this, you're going to be shining. I think I did one case report in my first rotation, then 2 case reports or 3 case reports in my second rotation. So that's gonna help you a lot. So make sure you do not miss out on these little opportunities, and these are the little ways to shine in your rotation. I think we have already spoken about this, that do your homework, like whatever cases you come across, you read about them, and in case you have any question, then the other day, like the next day, you go to your preceptor and tell them that, look, I was reading up on that case and I have a few questions. Let me know when can we discuss about those. So that gives a really good impression about you. The other thing that I want to talk about in this segment would be your communication and your networking. While you are on a rotation, it's a very good opportunity for you to network with other physicians as well. Whenever you come across someone, then you look them up, that what are they doing, because you come across a lot of people in the hospital, and you do that very frequently. So you always greet them in case you have any specific questions regarding their field of interest or in the field that they are working in. You can ask them, you can network with them. So I think that is a very good way of doing that. Never miss out on an opportunity in the hospital to network with people. The other thing would be communication skills, like how fluently can you speak English. I would tell you a very funny thing that happened with me, that in America, a lot of people think that if English, like for Indians, English is not our first language. So they always think that before speaking, we always translate Hindi into English and then we speak it, right? But it's not like that, because we speak English so frequently that it becomes a reflex for us, right? So just make sure that you speak fluently, you speak nicely, and even if you are a little bit underconfident, take it as an opportunity to become more confident. Talk with as many people as you can. Talk at the reception, talk with the nurses, talk with the family of the patient, talk with the patient, talk with your preceptor, and all the people possible, so that you can actually brush your English speaking skills for your interviews, for your subsequent rotation. So that is a wonderful opportunity to do that. The next thing would be going an extra mile during your rotation. What do I mean by that? That would be like asking your preceptor about their journey, because like two of my preceptors, they were Indian, and they could actually feel what it feels like. And a lot of people who are not up to date with how the residency process and the match process has evolved over the years, so that could be a really good talking point with your preceptor. Like, ask them about how their journey was, how did they decide to come to the US, what were their medical school experiences, what medical school did they go to, how did they get into residency, and how was their residency experience, are they in touch with their residency program, and how is their residency program, because trust me, you have an opportunity to get a potential interview from that residency program. Never miss out on these little opportunities. Ask them questions about life in the US, life in the state that they are in. Would they want to move sometime, or do they want to live here forever? How are things here, and how did they adapt into the American culture? Do they like it or not, and this and that. So there are so many talking points that you can have with your preceptor and get to know. And I'm not saying that you ask them just because you want to, and you're gonna gain something out of it, like you were gonna get interviews or something, but just be curious, right? Be interested to know their journey, because you can learn from their mistakes, you can learn from their struggles. They can have some unique struggles, and trust me, I enjoyed so much listening to my preceptors' stories and how everybody has a unique way of doing things. And trust me, it's not just you who are at a financial crunch when it comes to the USMLE journey. Even they were while they were applying, and it just feels so good to feel connected with people in the US, because it actually makes you feel that if they can do it, I can do it too. My God, they also had some financial crisis. I have that too. It was not easy for them, and it's not easy for me. So there are a lot of points to connect with your preceptor and other people, so don't miss out on those points. Another thing that you can do is asking help with personal statement application and definitely the interviews. So probably if the draft of your personal statement is ready, you can show it to them, or if you have not started your personal statement, you can ask them that do you have any idea that what a good personal statement would be like, what are the points that I should include, could you please help me with my application, could you please review it for me, could you give me some advice on how should I apply, and this and that. So you can take your preceptor's help with all of that stuff as well. That shows that you are interested in getting feedback, and you really want to improve on those points and everything. Trust me, my preceptor has helped me so much with my whole application, with my personal statement. And people in the US, they are super nice. They're gonna help you with everything, and just try to ask for help, and you're gonna get it. And I would also say that never be afraid from asking for special things. For example, I never understood the ventilator settings, right? So I asked my preceptor that, hey, could we do ventilator settings today, because that's a kind of a difficult topic for me, if you could help me with that. And since my rotations were in in the ICU, so it was a wonderful experience learning about the ventilator, what could go wrong, what are the common things that could happen. And you do not have to always agree with your preceptor. Like I and my preceptor, once we had a lot of discussion about intracardiac epinephrine, because that was a very interesting topic for me, and cardiac arrest was an interesting topic for my preceptor as well. So we had a discussion and I had a disagreement. So never ever think that since he's the preceptor, you cannot put forward your point. Like if you don't agree with something, you can say that, I feel that this should be like this. What do you think? So have a healthy discussion, a two-way discussion with your preceptor. Like for example, I remember that once my preceptor and we had to take care of an old lady, and she was, I think, 96. She had pneumonia and there were a lot of secretions, and my preceptor wanted to ventilate her. But I and the nurse, we were we did not agree to this point, because I felt that she was a 96-year-old woman. She had a normal saturation. If we intubate her, then it's very unlikely that she will be extubated, right? So I and the nurse said that we don't think that she needs to be intubated because she's maintaining the saturation, and I think we can simply bronch her and that's gonna be it. So our preceptor actually did not intubate her. So you can always put forward your point. You can always say that, look, I think, like, don't be assertive, but like always be ready in a healthy for a healthy discussion, and that should actually reflect in your tone and the way you speak. You should always be open to learning. That is the main point for rotations. So finally your rotation is done, and you always wanted to come on a rotation, and finally you did so great on that, and now you have to end the rotation on a note as high as you set it for the whole rotation, right? So how are we gonna end the rotation on a really, really positive note? Here are a few points. So the first point would be thanking your preceptor. Like, he was the one who helped you go through the rotation. He answered all your questions. He was so patient with you. He helped you with everything. So always thank him for that. Like verbally also say thank you, that I enjoyed a lot, I learned a lot, and I'm so glad that I came on this rotation, and thank you for helping me out, answering all my questions so patiently. Do say that. What I used to do was to make a thank you card, like a handmade thank you card for my preceptors. Like, I used to be very mindful of what I'm sketching. That should be something that I and my preceptor would connect on, like, and something that they can remember me by. For example, one of my preceptor, he told me while we were discussing his experience when he came to the US, he said that I came to the US on a one-way ticket. So I drew an airplane. Like, that was a really nice sketch that I did, and over that I also wrote that a one-way ticket to the US, and then inside I would like write a thank you note. Then another preceptor, we had a really inspiring story about a mango tree. So I drew mangoes, like a mango tree, and that is what I gave it to him. And like, just be very mindful with things. Don't think that you can buy something and give it to them and that would make them happy. Like, handmade things, they have a lot of significance. So I used to give greeting cards to my preceptor once my once my rotation would end. The other thing would be to ask for feedback. Like, ask them, how did I perform on this rotation? Is there anything that I can improve on my subsequent rotation? Is there any advice that you would want to give me for the whole match process, for my application, for my personal statement? Ask for feedback when you are completing the rotation. That is very, very important. That shows that you were really interested and then you want to improve in life in general. So that gives a very good impression about you. And then finally, the time comes, you have to ask them formally for a letter of recommendation, and that should be waived. What I used to do was that I used to go to my preceptor on the very last day and say that now that the rotation is over, I would love if you could write a letter for me, and that should be performance based. I want to keep it waived. Ask them formally, don't forget about it. Even if you have to send an email, just to formally do that. Now at the end of this video, I'm gonna give you a really special tip that I used to do. Like, nobody told me this, I just did it on my own. So I used to have a document in place for every rotation, and date wise I would write whatever I did. Were there any special patients that I encountered? Were there any codes I encountered? What are the things that I did? Were there any special things that I did on that particular day? The topics we discussed, the talks, the presentations, like everything that I did on that day, I used to document that in a Google Doc. And then at the end of the document, I used to write what all did I learn from that rotation. I learned how to maintain patient privacy. I learned how to, how to do family meetings, stuff like that. And then at the end of the rotation, I used to ask my preceptor while I was asking for the letter that, look, I have a document in place. I know that it's difficult to remember each and every day and whatever we did. So I have this document in place which has all the topics and the things that we discussed and did during the rotation. I can share that document with you so that, it becomes easy for you to write the letter. That is the most wonderful thing that you can do. I don't know, nobody taught me this and I did it on my own, and it is a wonderful thing because it's a document for you to remember everything, because trust me, you will forget everything. Do not forget to document your each and every day of your rotation. This is like the biggest tip that I can give you for your rotation. Document each and every day, each and every topic that you discussed about, because you will be asked about it in your interviews. You will have to mention it in your application, and this document will help you so much. And I'm so glad that I have all those documents in place. Trust me, you will feel as if you will remember everything, but you will not. Make sure you update that document on an everyday basis, and like each and every topic that you discussed about, every person that you met, if you learned something new, if you watched a procedure. I don't know how much I'm stressing on this topic, but trust me, I need to, because it is that important. Document each and every day of your rotation. Share the document with your preceptor so that they also do not forget to add that stuff in your letter, and you're gonna be all set. So that would be the most wonderful thing that you can do during your rotation, is to document each and everything. So don't forget that. So that's it for this video, and I'm so glad that I could finally make this video. I love when you guys send me emails regarding different aspects of the USMLE journey. They are mainly about the USCEs and electives, and I love answering your emails. I would love to give back to the community in any way I can, be it from my experiences or whatever I learned when I went through things. Make sure you like, share and subscribe my YouTube channel. This video is a little bit long, but trust me, it's gonna be worth it. This journey does feel a little bit long, but it's gonna be rewarding in so many ways. You will learn about yourself. You're gonna discover so many different things. You're gonna learn about life so much, and just keep at it, keep working hard, keep moving forward, and let me know if you have any questions. I will put my email ID in the description, and I'll see you guys in another video. Bye.